Nathan Seven Scott. I am actually in the dental office today. I had my teeth cleaned, and we're here with the two dentists that run the office, and I'll just let them introduce themselves, and then we'll go further into the conversation.
Hi, I'm Dr. Luann Curatola. I'm a general dentist, and this is my partner and spouse.
I am Dr. Joseph Zagami. I am a dental specialist in prosthetics.
I wanted to do this interview because I realized that a lot of people, I know a lot of my peers, don't necessarily take good care of their teeth. So can you expound a little bit about people who have beautiful teeth but may have cavities or other things going on within their mouths?
Yes, that's for sure. As we know, Nathan, a beautiful smile and a healthy smile is our ultimate goal here. And of course, because your teeth look great and you have them aligned, and when you're in those years growing up in your family, many people do get care, but as they go on and they're busy starting their careers, launching their careers, just because there isn't any dental pain doesn't mean that you necessarily have the healthiest smile, and that's why we're very big proponents of preventive dental care. Come in, get your cleanings, have your x-rays done, oral cancer screening, and make sure that that smile that looks beautiful is healthy.
And today, we have so many conservative ways to take care of a simple filling. Years ago, we would have to take a lot more tooth structure away. With the conservative bonding and cosmetic appliances that we have, we can really preserve tooth structure as well as enhance longevity of the tooth and the smile.
Mm-hmm. Now, a lot of people tend to be afraid of the dentist. Why do you think people are afraid of the dentist?
Well, this is one profession that doesn't necessarily get the best media coverage, as you know, from many films and spoofs and different sitcoms. But, I think we're really we're breaking down that barrier. Years ago, of course, pain management was not often as successful and as comfortable as it is today, and we really are now seeing the results of a generation that is starting to grow up without all those premeditated fears about dentistry. So I think things are starting to change. We'd like the media along with us, and I think like what you presented is that if you come for your regular preventive dental care, you will definitely avoid those more painful situations because we can really intercede and keep things healthy and comfortable and pain-free.
I think our training also has changed. Growing up in the 50s and 60s, dentistry was much, much more intimidating. The surroundings. Today, it's a pleasant surrounding. We're trained in more modern techniques that are more efficient, faster, and certainly give us a lot more to choose from in the materials and the procedures. And I don't think our parents give us that line where, if you're not good, Johnny, I'm taking you to the dentist.
Right.
I think, parents have also gone through some changes as well in the upbringing.
Okay.
And a lot of what we do here in the office when we meet our pediatric patients, they're really our VIP patients. They're our patient of the future, and that's who we want to instill and build that comfortable rapport, kind of an extension. It's very rare now when you come into the reception room and there's a young patient and they see the white coat. Years ago, they used to, duck and cover, but, now today, they know we're a comfortable liaison of healthcare.
The other interesting thing, as far as our practice is concerned, because we are very patient-oriented, we can really spend a lot more quality time with those young patients that may not require a lot of dentistry today. They can be more nurturing, they can be much more relaxed in this environment. So the apprehension and fear is eliminated almost 100%. And then those patients are going to grow up to be better dental adult patients.
So now, what would you say is your ratio of men to women as far as dental health care? I know, in my opinion, I don't think men take as good of health as with their teeth as women do. So do you have more female patients or more male patients?
Definitely more female patients.
Hands down.
Yeah.
There's no question that, when the men come in, they're really at the dental terminal end. dentition for the most part.
Okay.
There are some fastidious male patients in our practice, but
Sure.
I would say that for the most part, you're right. I mean, most men do not take care of their health and also their dental health.
Right.
Things are changing, though. I mean, you know, you do see, it's very funny because when you meet an entire, and the unique thing with our office is that because Dr. Zagami is a prosthodontist and he tends to treat people with more advanced disease, and I'm a general dentist and I see from, you know, children through adult. We have a very broad range of patients here, and it's interesting because it'll be the mother or the female matriarch that walks in first, and then she gets everybody in, the husband, the children, the sister, the brother. So it's an interesting thing, but the women definitely drive healthcare. I think they are. They're the ones that you know, basically are very healthcare driven in that regard, and they're still the majority and probably the most conscientious patient.
Okay. So let's talk a little bit about cosmetic dentistry. I know lately there's been a big craze of people wanting to whiten their teeth and have the brightest and whitest smiles. What are the pros and cons of having the whitening done, the bleaching?
Being in Manhattan and being in a cosmetically driven office, of course, we have always offered in-office tooth whitening systems from 1990, really pretty much their inception. At that point, bleaching was really done on non-vital teeth because there were still concerns about whether the bleach could damage vital tissue. And we know that that isn't the case. But with the rapid advances and, of course, society being as it is, embracing this procedure, and then, of course, many manufacturers jumping on the bandwagon and pumping out all these products, which were maybe not the safest, there are concerns today. Of course, the pros, that gorgeous, bright smile, it is rejuvenating. As dental practitioners, we, of course, embrace the procedure, and we love patients who are happy with their smile, because if you love your smile, you will want to take care of your teeth and you'll want to restore your teeth, and that's one of the real pluses of what the whitening systems do. But I have to tell you, I have tremendous reservation about the over-the-counter products, the products that are accessible on the internet, in the supermarkets, in the drugstores, because patients, we no longer have that concern. We used to dispense our products and our patients would use them home. They'd come back to check with us. They would only have access to a definitive amount of product where they had to achieve their goal. And there was this doctor-patient relationship in bleaching. And now basically anybody could do it. It's dispensed any which way you want. And now this gel, which is a peroxide-based gel, is being exposed and prolonged in the mouth, and that is not the original intention of the product. So we are concerned, and we are very careful with how we dispense the product in the office and what type of product is dispensed, and that we don't create and perpetuate this bleaching mania. You know, if you need your smile to be, you know, a perfect, you know, Hollywood white smile at all times, and there may be a safer or permanent dental procedure that you should inquire about.
Those procedures would include porcelain laminates as a very conservative approach to a dental cosmetic procedure to enhance one's smile without doing crowns. And we do treat a lot of patients that have those concerns. One of the cons with the bleaching is that patients that have had bonding procedures or veneer procedures or crowns are really not going to gain the same results that natural teeth. And there are different entities that will not allow teeth to bleach as much as possible.
Okay. I'm going to stop.